The rapid discovery in less than 1 year of safe and effective vaccines against COVID-19 is a massive achievement of science, international solidarity, and public-private partnerships. At WHO, we're pushing hard to ensure these vaccines are made available to every country and every community quickly. It would be incredibly unjust, for example, if low-risk groups in wealthy countries are vaccinated ahead of frontline health workers and other high-risk groups in low and middle-income countries. National authorities are ultimately responsible for deciding whether a vaccine is made mandatory. A key example is the yellow fever vaccine, which is required for travel from endemic countries to non-endemic ones, and this is common across Africa and in other parts of the world. In some countries, mandatory vaccination is a school entry requirement for children, and in some communities, this works well. Overall, though, the evidence is mixed when it comes to the success of mandatory vaccination in increasing immunization acceptability and coverage. In general, WHO does not recommend mandatory vaccination because if people have concerns or are hesitant to get vaccinated, they may go to great lengths to avoid it. Communication about the importance of vaccines is key. We're working with governments, communities, and partners to share data and information about vaccines so that people recognize that these products are safe and beneficial, and they'll be leading the charge to get vaccinated. We've seen this, for instance, with mass campaigns to kick wild poliovirus out of Africa. When people understood how valuable the vaccine was, they were prepared to travel many miles with their children to protect them from this disease. Also, mandatory COVID-19 vaccination would not be feasible for the foreseeable future. Manufacturers are working day and night to produce sufficient quantities to meet the worldwide demand for these life-saving products. We anticipate that in Africa, it'll take at least this year, and possibly longer, for the COVID-19 vaccines to reach a significant proportion of African people. In some professional settings, for example, among hospital workers, we may strongly recommend vaccination, but we also support the freedom of individuals to make their own choices. We'll continue working with governments to strengthen health systems and services so that every person can access reliable and clear information about vaccines and to ensure equity in access to these and other essential health products.